If you're someone looking for any kind of bipartisanship in Washington, D.C. these days, you might have been encouraged by the 17 Republicans voting with Democrats to extend the subsidies for the Affordable Care Act.
Those subsidies were designed to help get people through the pandemic, but Democrats say even though the pandemic is over, people can't pay their premiums and taxpayers should help.
16 years ago this week, President Obama signed the Affordable Care Act into law, and in this evening's Buckley Report, Bob takes a look at what made that act something less than affordable and how that might be fixed.
It was an applause moment for many people, health care coverage for almost everyone, and the man whose name was eventually on it promised us
good health insurance for the price of your cell phone bill or less.
That wasn't remotely true, was it?
No.
Tina Marsh-Dalton is an economist at Wake Forest University who says the Affordable Care Act did make a difference.
We went from about 15% uninsurance before the ACA, and between 2013 to 2016, the uninsurance rate in the U.S. dropped to about 8%. This is according to the Census Bureau.
Better, but not great.
Better, not Europe, right? But better, so that it worked somewhat.
Dalton says the ACA was targeting the meat in the insurance sandwich. Nearly 65% of people are covered by employer-sponsored plans, and another 20% by Medicare or Medicaid.
Then we had the segment in the middle that did not have any care, and this was the real problem that the ACA was trying to fix.
The problem was it only worked on half the equation.
One thing the ACA did not do is it didn't address costs at all. So what it was focused on was getting people covered by insurance. What Americans often confuse is health insurance coverage being the same thing as health care.
The law assumed people would shop around for a good deal.
All right, so this is showing how it changes by household income.
And while some cities had a bit of choice,
24 health plans.
Not 24 insurers.
Many have only a couple, and the law doesn't allow people to go buy the plan that fits their needs in an open marketplace.
When the ACA marketplace knows that people can't go out in the actual free market and purchase insurance on their own, they have a lot more flexibility with increasing premiums.
And they have to increase premiums because healthcare use is way up, but the payments aren't spread out among the entire population because healthy people tend to opt out.
Who likes to buy insurance? Sick people like to buy insurance, right? So the insurers are looking at this market, and only the sickest people are entering the market, which means the premiums are going to be very high, which is going to discourage healthy people from joining it. Premiums are going to get higher, and we have something, they actually have a cool word for it, called the death spiral.
That death spiral of premiums led to the federal government offering to pay much of the tab for millions of people to help them get through the pandemic. And once the pandemic was over, the subsidies were supposed to expire. And that is what Congress was fighting about last fall.
There is the possibility that some people will see their insurance double. However, we are just reverting back to the way it was in 2020 and before.
Instead of subsidizing high costs, we should focus on the high costs. And that was one thing the ACA didn't do. It didn't have any provisions for costs.
The recent vote in Congress to extend the subsidies gives them 3 years to figure out how to get it right. Bob Buckley, Fox 8 News.
Both Professor Marsh-Dalton from Wake Forest and Joseph Harris from the John Locke Foundation believe we should make our health insurance look more like car or homeowners insurance, covering the big things we can't always predict, like cancer, but not covering every procedure from the flu vaccine to a teeth cleaning.